I'm Dr. Aimee Sisson, Health Officer for Yolo County, with a message for our school community. As in-person instruction resumes after the winter break, I urge everyone to take additional precautions to protect against COVID-19. The Omicron variant of the SARS-CoV-2 virus that causes COVID-19 is the most contagious form of the coronavirus we have seen during the pandemic, and it is spreading rapidly in Yolo County. The Omicron variant is the cause of nearly every case of COVID-19 in Yolo County, according to genotyping done at the UC Davis Genome Center. Yolo County's COVID-19 case rate is rising and now qualifies as high community transmission, according to the CDC's framework. In the last 2 weeks, Yolo County's case rate has increased by 121%, from 10.9 to 24.1 cases per 100,000 residents per day. I am asking all families to take 4 actions to safely keep children in school during the current Omicron surge. Number 1, get vaccinated if you haven't already, and get boosted if you're eligible. Everyone 5 and older is now eligible for the COVID-19 vaccine. Boosters are recommended for anyone who is 16 and older and at least 2 months have passed since receiving a dose of the Johnson & Johnson vaccine, or at least 6 months have passed since receiving your second dose of the Pfizer or Moderna vaccine. Later this week, we expect booster doses to be available for children 12 to 15 years old. While it is true that even people who have received boosters are becoming infected with the Omicron variant, the vaccines continue to protect against severe disease, including hospitalization and death. In New York City, which is ahead of us with its Omicron surge, COVID-19 hospitalizations among children increased by 395% from December 11th to December 23rd. None of the hospitalized children were fully vaccinated. In addition to providing protection against COVID-19, being up to date, that is, fully vaccinated and boosted if eligible, with COVID-19 vaccines allows students to remain in school and extracurricular activities after coming into close contact with a case. Number 2, upgrade your masks. 2-layer cloth masks do not provide adequate protection against the Omicron variant. If you wear a cloth mask, use a replaceable PM2.5 filter between the 2 layers, or wear a surgical mask underneath the cloth mask. Surgical masks are available in child sizes. Another option is a more tightly fitting KN95 or KF94 mask, which is available in child sizes. Number 3, test for COVID-19. COVID-19 can be spread by people who don't have symptoms or who have mild symptoms that may look like allergies or a cold. Any symptom on the long list of COVID symptoms is COVID until proven otherwise. Fever, chills, headache, body aches, fatigue, cough, shortness of breath, sore throat, runny or stuffy nose, loss of taste or smell, nausea, vomiting, or diarrhea. In addition to testing for people with symptoms, testing is also important for anyone who has come into close contact with someone infected with COVID-19, even if up to date with vaccination. Test twice after an exposure, once right away and again 3 to 5 days later. Because many students and families traveled or participated in holiday gatherings over the winter break, they may have been unknowingly exposed to COVID-19. The state of California has purchased home antigen test kits for every public school student in California, and these kits will be available on campuses later this week. Each kit contains 2 tests. Use the first test right away, and then test again 1 to 3 days later. This widespread testing as students return to school will quickly identify any students infected with COVID-19 to prevent further spread within the school community. Number 4, stay home when you are sick. I know this is not easy for working parents, but it's very important that students who are not feeling well stay at home so that they don't spread infections to others. If your child is ill, get them tested for COVID-19. Even if they test negative, do not send them back to school until they're feeling better. The California Department of Public Health has shortened the isolation period for most people with COVID-19 to 5 days and shortened the quarantine period for most people exposed to someone with COVID-19 to 5 days. Yolo County's isolation and quarantine orders will soon be updated to align with CDPH, along with the decision trees posted on our website. It's important to note that someone must test negative to be able to leave isolation or quarantine before 10 days. Yolo County is working to make free rapid antigen test kits available for people to test out of isolation after 5 days. PCR tests won't give an accurate result in someone with a recent positive test. We will have more information on these plans in the coming days. Thank you in advance for taking additional steps to keep Yolo County children safely learning in their classrooms for the second half of the 2021-22 academic year.